If you're thinking about having an orthopedic procedure, if you've got friends, if you've got family who are thinking about having orthopedic procedures done, I want you to watch this in its entirety. I want you to share this video with them, and I want you to have them think, or have yourself think, about some of the potential implications of an orthopedic procedure. The reason I'm making this video is there's so many people who just blindly go into procedures or take recommendations from the first person that they talk to and move forward with a procedure they might not have even needed. All too often I talk to patients who go through with a procedure and they're worse off than they were before, or their pain's not relieved, or they're in a situation where they didn't have proper expectations about what happens after surgery. Because the truth is, many times after you have a procedure, the pain's not gonna initially go away. There's gonna be a period of either rehab, recovery, where you're gonna have to go through some of that, rather than it being just a quick fix where everything's gonna be better immediately. So I'm making this video so that you can hopefully have a better understanding or share with an individual you're concerned about some of these things to think about before you have a procedure. I'm Dr. John Schaefer. I'm a physical therapist. I've got family members who are surgeons. This is an ongoing conversation. I respect surgeons. I know they do a phenomenal job, and in many cases can make a life-changing difference. But what's so important is that you understand what your options are, understand where surgery falls in the grand scheme of things, so you can make the best decision for yourself. You can make the best decision with your loved ones, rather than just going with the first thing that you hear, thinking that surgery is the only option, because oftentimes there are so many other options that are important to explore. So let's talk first about just the changes in the overall medical model. So let's talk a little bit about the old medical model first, how things have been traditionally in the past. In the past, you'd see your orthopedic doctor would request imaging, imaging would show changes. Even with imaging that shows changes, some of them could be normal age-related changes. Many people who have these types of images have no pain, and there's also people who have images that look clean or don't show as many changes, and they're in tremendous pain. So imaging is not the end all. After you get the imaging back, we notice changes. The doctor would prescribe injections, oftentimes cortisone shots. Cortisone shots can be helpful. They oftentimes act as a band-aid for short-term relief. So they're very good in that sense if an individual is doing something to address the root cause during this time, like physical therapy, strengthening, figuring out ways to address, again, that root cause. Injections don't work. Then the individual is sent off to physical therapy, maybe for 6 or 8 visits. And if they don't see progress, then having surgery. And the problem is, you're not always gonna see progress in 6 to 8 weeks. So having a clear understanding of how long the rehab process could take will be very helpful for you as well. The new medical model involves taking a more conservative approach earlier on, so not even worrying about imaging right off the bat, because we know it's not incredibly reliable. Instead, scheduling a physical therapy exam. Physical therapists are orthopedic experts, so going to physical therapy, having those 6 to 8 visits, and if you're not seeing progress after that, no problem. A physical therapist can refer you to an orthopedist, who can then perform their evaluation, then get imaging as needed, then get injections as needed. And if none of that seems to be working or getting the results that the individual desires, they can still have surgery, but at least they're taking that conservative approach early on, and they're trying some of these different things without getting worked up in the imaging, without thinking they need pills, injections right off the bat. Because a lot of those different treatments are what we call passive. Something's being done to you rather than you taking an active role in your recovery. Our bodies have a tremendous ability to adapt when stressed appropriately over time. But if you're not stressing your body over time, if you're spending time in the seated position, if you're not very active, your body loses that capacity, and then when you start to do those activities again, that's when you start to have more pain, and it's just a cyclical spiral in which you're not seeing the improvement you want. You think surgery is going to come in and be the only thing to fix it? Well, think about this. Even after you have a surgery, you're going to need to have rehab. There's going to be some point along the line where you're going to have to step up and you're going to have to stress your body's tissues appropriately. So would you rather do that beforehand, trying to make that difference, or have the surgery and then have to do it afterwards anyways. What we're seeing now with a lot of patients that come through my door is we're doing a lot of conservative management early on, and even if a patient is scheduled to have surgery, we'll do rehab beforehand so that the recovery is a lot easier on the back end. The reason I'm so passionate about this, and the reason that this is so important for you to see, for your loved ones to see, is because a lot of surgeries can be prevented. I see patients who have had back surgeries and they feel exactly the same afterwards, and they're thinking they're gonna come out of the surgery and have no pain at all. I see people thinking about having shoulder surgeries who didn't know that they were gonna have an extensive rehab process. So when I talk to them and I say, hey, this is gonna be an ongoing process for the next 3 to 6 months, they're shocked. They can't believe it. And I'm thinking to myself, how has no one had this conversation with them? Rehab is going to be a part of your recovery, whether there's surgery involved or whether there's not. So understand that this is going to be an ongoing process, and it's not always an easy, quick fix. So before you jump into surgery, before you continue with injections, before you continue to pound medications, just go see a physical therapist. They can do a quick evaluation on you and tell you, hey, this is something that can improve with X amount of weeks of therapy, or hey, this is something that I can't help you with. Let's get you into an orthopedist. This is something that you need surgery for. I tell friends, I tell family, there are very few situations that I'd have an orthopedic surgery without at least attempting conservative treatment, unless it's a situation where there truly is a bone that needs to be realigned, a tendon that's not going to heal on its own, something like that. But for most cases, some of the most common areas where I think surgery can be avoided: rotator cuff repairs, not always necessary; meniscus repairs, not always necessary; back surgery, not always necessary. And the reason these aren't always necessary is because for the shoulder, for instance, most cases they'll heal themselves over a year. With back surgeries, there is such a lengthy rehab that can be involved, and just the variance in terms of amount of relief you can get, I would really think twice before having a procedure on your back, unless it's a situation where you're having weakness in your legs or that's a very progressive case. And then with the meniscus, so many people over the course of their life have degeneration to different areas, whether it's rotator cuff, whether it's a meniscus, these age-related changes, and they don't have pain. Others do have pain. We don't necessarily understand why in all cases, but what we do know is that if you do strengthen the areas around the injured tissue, modify your activity load, and increase your body's capacity to do the things you love, oftentimes people get better, and oftentimes people are able to do all the things they want to do. So don't get wrapped up in thinking surgery is the only answer, because it's not. There's a lot of alternative options, and a great one is seeing a physical therapist, someone who understands movement, understands your tissues, your body, understands orthopedic injuries, because they can help you get better without having to go underneath the knife. Thanks for listening to my rant. If you have any questions or want to talk about your specific situation, shoot me a text at the number below or send me a question in the comments section. More than happy to answer, more than happy to see if it makes sense. Like I said, love surgeons. I have family members who are surgeons, but it's not always the only answer.